Hi folks, today we're going to talk a little bit about transient visual loss. Transient visual loss is a very common ophthalmologic complaint in any practice and raises concerns for the patients and for the doctors. By definition, transient visual loss should last less than 24 hours. They can be monocular or binocular. If transient visual loss is monocular, it's usually associated with a cause in the eye. If it's binocular, it's usually related to a disease or an abnormality in the chiasm or in the brain. It's very important to keep in mind that often transient visual loss may be associated with thromboembolic events, and if they are recognized, systemic workup should be pursued. So with that in mind, I'm going to talk to you a few causes of transient visual loss. The first one you need to know is emboli. Thromboembolic events may occur in the heart, in the internal carotid artery, or near to the eye vasculature. Every time you see a patient with an emboli to the eye, systemic workup with imaging of the heart and the internal carotid artery should be done. The emboli may be related to cholesterol, calcium, or platelet fibrin emboli. A second cause of transient visual loss may be similar to a retinal vein occlusion, something like an impending non-ischemic central retinal vein occlusion. You're going to see tortuous retinal veins, and usually the symptoms may last up to a few hours. A third cause of transient visual loss is giant cell arthritis. Patients may have recurring loss of vision for a few minutes, and they're usually going to have the typical symptoms of giant cell arthritis, like jaw claudication, photopsia, among others. Another cause of transient visual loss is ocular ischemic syndrome. Change in the perfusion of the carotid artery may lead to ocular ischemic syndrome, and the patients are going to present with red eye, change in the vasculature around the eye, and tortuous vessels in the back of the eye. In addition, the retina will be very ischemic. Another cause of transient visual loss is systemic hypoperfusion. If there is reduction in the cardiac output or reduction in the systemic blood pressure, there may be a reduction in the blood flow to the eye vasculature, and patients will have binocular reduction of vision and may have some associated neurologic symptoms like confusion. And another cause of transient visual loss is retinal migraine. By definition, a patient to be recognized as retinal migraine, they must have two positive eye phenomena or photopic phenomena like photopsia or flashes of light, or they may have one negative symptom like blurry vision plus migraine without aura. Usually patients with the retinal migraine may have a recurring visual loss or visual symptoms that last a few minutes. There is another condition that's similar to the retinal migraine, which is retinal vasospasm, which may be similar to a retinal migraine. So I presented to you in this mini lecture the definition of transient visual loss with visual loss for less than 24 hours. I told you it can be monocular or binocular. I told you the importance of thromboembolic events and their workup, and I presented to you 6 main causes: emboli, retina vein occlusion, giant cell arteritis, systemic hypoperfusion, retina migraine, but there can be also other more rare causes. I hope you've been enjoying these mini lectures, and see you next time.